And I propose that we start immediately with your oral presentation. You have the floor.
Thank you very much, Mr. President of the Executive Board, heads of delegations of Member States, ladies and gentlemen. I was already introduced. My name is Dr. Tedros, and it's my pleasure to address you with my capacity as candidate for Director General of the World Health Organization. I am a candidate for the Director General of WHO because I believe in the power of this organization to make tangible and positive impact. Before I proceed to my written statement, I have, with a spirit of candor, would like to raise some issues maybe that I would like you to do some soul searching, because these three issues were very important during my discussions with many of you member states. The first one is on budget issue, and the second one is on emergency response, and the third one is on universal health coverage. On budget, as you know, the assessed contribution is only 20%. And compared to the 1970s, which was 80%, it's really low. But not only that, if you compare the value of the money that was contributed at that time, during 1970s, and what member states are contributing now, except a correction for inflation, some experts said that the contribution actually didn't increase. I don't think this is right, and that's what many people are saying. Take a business model. A business model, unless you have, or business entity, 51% of ownership, can you say you own that entity? So the question is, do we really own the WHO? Do we own it? That's the question that was coming into my mind after I discussed with you, with many of you. And I will tell you another fact. This is a New York hospital, Presbyterian Hospital, New York. It has a budget of $4.8 billion US, one hospital. And you know WHO's budget. Is this really the right thing? And many are asking. Why are we not having the commitment to really own WHO, to make it truly belong to the member states? Because unless we empower WHO, and empowerment comes with resources, unless we ensure ownership of WHO, I don't think we will expect result. This is very important, and I think we need to really do soul searching. I have been listening to you. I will continue to listen to you. But we need to really discuss it candidly in the coming occasions, because it's very important and central. Ownership is important. Ownership is important. And then I will tell you the second one on global health security. Just one issue on that. The Internal Health Regulation 2005 is not being implemented properly. Its implementation is weak. And there is one thing that many member states raise. Some say because of fear of punishment, if we report early, we don't do it. And I said, what's the reason? Because we could be punished. And the world is not ready to implement the International Health Regulation in full. There is cherry picking. That's what they said. If you report, then travel ban is imposed. Is this the right way to implement international health regulation. You remember when Ebola struck, 3 countries were almost quarantined. But the international health regulation says there should be no impact on mobility and trade when we implement the international health regulation. It says it there. It's in the international health regulation. But we're not implementing it fully. Because when countries implement or report, the consequence is travel ban. The question here is, how do we ensure true solidarity? Are we really ready for solidarity? Or do we just go for narrow national interest and immediately act in the interest of our own narrow national interest without seeing the impact on others? I'm saying candor is necessary on this also, because organizations can only survive if there is candor, if there is honesty, if there is determination to really discuss about these issues, to listen to each other with respect, understand the root causes of the problem, for instance, for these two. Then the third is on universal health coverage. In 1947, when WHO was established, we said for health for all. In 1970, Almaty Declaration, we said the same thing. And 2016 now, fast forward, with SDGs, we're saying universal health coverage. Health for all. We're not walking the talk. Promises for more than 6 decades. What's happening here is the question of many of us. Is it a resource problem? I don't think, and many don't agree. Because countries with limited resources have done it. Many, but among those, I can mention maybe Sri Lanka. You know, they cover in Sri Lanka even cancer treatment, full. So is it resource a problem or lack of political commitment? This also needs soul searching. I'm challenging you to really listen carefully, really with honesty to each other and address these challenges. These are the 3, in the spirit of candor, that I would like to put forward to you, which are not new, but just to put the importance of really candor. And I will continue to listen to you and to be as candid as possible, because I believe unless we discuss candidly, I don't think solution can come. Unless we discuss candidly, I don't think we can really go to the root cause of the problem. Now, I would go to what people ask me why I'm running for WHO Director General position. They say, why you? And I say 4 things to them. And I will say it today. 1, I have the passion. And 2, I have the hands-on experience in leading change, both national and international. And 3rd, I have the technical expertise, the political leadership, and also the diplomatic skills that WHO needs. And number 4, I am from a developing world where the burden of ill health is really heavy, and I faced the challenge myself with my communities, and we can bring fresh perspective to WHO. And also as an outsider with good knowledge of WHO's internal working environment, I can bring a fresh view also to WHO. I will start with the first one, passion. My passion for public health was ignited when I was growing as a young boy in Africa, witnessing the first-hand impacts of malaria outbreak on my community. After I graduated, I was hired by Ethiopian Malaria Control Program in 1986 and joined a team in 1987 to control raging malaria outbreak in southern Ethiopia. I saw firsthand that most of the people in the community were bedridden and witnessed many deaths. That was the saddest moment for me. I remember the situation even today very vividly. Of course, we controlled the outbreak in 3 to 4 weeks with mass treatment, vector control, and so on. I not only, with my colleagues, tackled malaria, but because of the high prevalence at the time, I also succumbed to malaria infection. That was what emboldened my anger on malaria, and for that matter, any outbreak or emergency, and the passion for public health. And the second hands-on experience in change leadership, I started my role as a health minister in 2005, dealing with an emergency response to a massive malaria outbreak in the country. As a minister, it was a good opportunity for me to retaliate because my inside was boiling. We revised our malaria control program, prepared ambitious plans, and immediately mobilized 20.4 million insecticide-impregnated bed nets in just 2 years, the largest bed net distribution in Africa at the time. We expanded indoor residual spraying coverage, expanded larval control. As a result, Ethiopia has not experienced major malaria outbreak for the last 11 years. In my ministry, as a minister, parallel to fighting epidemics, we started ambitious reform program of the health sector. The reform covered all building blocks of the health system, with service delivery, workforce, health financing, health management information system, pharmaceutical supply system, emergency response system, which included disease surveillance, detection, early response, and recovery system. In the service delivery reform, universal primary health care was the center of gravity, being primary, focused on health promotion and disease prevention. 6 years later, we had built almost universal primary health care. When we targeted to achieve this, many thought we were crazy, but we did it. At the same time, we looked into the broader public health in a comprehensive way and seek for efficiency and impact on how to impact service delivery and community engagement. We have not only developed our local innovative solutions that are responsive to our local context and challenges, but also looked to the best practices of other countries and took their lessons to revitalize our health system. These interventions resulted in increasing life expectancy at birth from 46.7 years in 1990 to 64 years in 2013. Many other indicators which I don't want to go into, but if I put just one, under 5 mortality declined by 2/3, 3 years ahead of the 2015 deadline. And the decline on HIV infection, malaria, mortality, and TB mortality was very significant. At a global level, I co-chaired PMNCH, Rollback Malaria, and UNAIDS. Of course, the most challenging was chairing the Global Fund Board from 2009 to 2011, when Global Fund was being heavily criticized for lack of effectiveness, accountability, and so on. I oversaw a comprehensive reform agenda aimed at improving the challenges. In parallel, we also established an independent panel to assess and provide recommendations, and this reform has guided the Global Fund to be effective, transparent, and accountable organization it is today. And you remember the $13 billion it raised just last month in Montreal. And the third is the technical expertise, political leadership, and the diplomatic skills I have. Reforming all building blocks of the health system requires strong technical expertise. And under my leadership, the health sector actually expanded significantly. And from just 600 health centers, we reached 3,500 health centers, from less than 1,000 health posts to 16,000. That's what I say, near universal primary health care in just 6 years that we achieved. I oversaw also training of 38,000 health extension workers, all of them women by design, to increase the utilization of services by women in Ethiopia. And the community community-driven system with women at the core. And we have 3 million strong health development army that's composed of women alone. And not only that, we increased the workforce from 16,500 to 115,000. And the shortage of doctors was a problem, and we introduced innovative ways of converting regular hospitals into teaching hospitals with less investment, and increased our enrollment from 300 to 3,000, because brain drain is not the root cause. We believed that a mismatch between supply and demand was the root cause, meaning the problem is ours, when we admitted that the solution came. That's why for the first batch now will be graduating this year, and it's 2,600, from graduating only 150 a year in the past. Additionally, I have worked tirelessly to champion country ownership so that affected countries are able to guide and inform global health discussions that affect the health of their populations. This all needed securing a buy-in from our communities, leaders at all levels, partners, mobilizing them to our goals. Very often encountered resistance. But we were able to mobilize to achieve our goals. As Minister of Foreign Affairs, I successfully helped bring together 194 UN member states to agree to the Addis Ababa Action Agenda, a historic milestone forging a global partnership to achieve and finance the Sustainable Development Goals. Glad to be associated with SDG this way, as chair for the negotiation of the Finance for Development, and eager to serve and see the outcome, health being one of the SDGs. I also played a pivotal leadership role in the AU's response to Ebola epidemic, facilitating greater country ownership, promptly mobilizing 200 Ethiopian health workers to join the African Union team, urging countries to adhere to the WHO guidelines. Number 4, the reason is, as I said earlier, as an outsider with good knowledge of WHO's internal working environment, and also as one from a developing world, I can bring fresh perspective. Someone grown up and faced the challenges firsthand can have, as I said earlier, not only the passion, but the understanding to bring a fresh perspective. And with that, I go to my vision and also the priorities. First of all, I would like to thank you, Member States. I attended all regional committee meetings, all of them. I met 182 countries out of 194 bilaterally. And the 5 priorities, I will tell you, actually crystallized from that discussion. And I thank you for that. I feel like I'm reporting back to you. And I envision a world in which everyone can lead a healthy and productive lives, regardless of who they are, where they live. Achieving this vision and the Sustainable Development Goals requires a strong, revitalized WHO that's effectively managed, adequately resourced, results-driven, and led with political acumen. As we know, WHO is facing questions over its very identity and purpose. Yet, at its essence, it's an organization that has the power to change and save lives and make an enormous impact on the world. I'm standing as a candidate to become the Director General of WHO is because I know what it takes to care for those in the world who need it most and who have the least. And I know how to make sure WHO's impact is felt on the ground in daily lives. I believe in WHO's potential, and I believe I will be able to help it get there. The challenges are so broad and multifaceted that no single region or organization can manage them on their own. In order to address them effectively and save millions of our fellow citizens, we must act together. And my first priority is transform WHO, reform. And a new and challenging health landscape can only be matched by a responsive, adaptive WHO. Building WHO into a more effective, transparent, and accountable agency that's independent, science and innovation-based, results-focused, and responsive will be my first leadership priority. This transformation will require striking a balance between bold reform and the stability of the organization to deliver results. Reform and stability is very important to get things done. WHO, as I said earlier, should be empowered by having access to more assessed contribution and basket funding to use it based on its priorities. Empowered WHO will be more productive. I will ensure that our financial and human resources are focused on those areas where we can make the greatest differences for humanity. I will also create good relationship between management and staff, and I will give special attention to staff concerns and address internal good governance problems. Will motivate and inspire staff, because change comes from inside. I will work to enhance predictability and flexibility of WHO's financing by positioning health as a security, economic and development priority through political leadership. I will establish an interministerial advisory commission composed of ministers of health, finance and international development to solicit advice and address the budget issues that we have at the moment. I believe decentralized and empowered system with appropriate accountability mechanisms brings better result. I don't believe that the current structure is a problem, but we need to continue to strengthen the global policy group. We need to have a mechanism for accountability, and we have to formalize it. If we can do this, actually an empowered and decentralized system is more productive, because not only the labor at the grassroots and at the regional level, we will use the mind, because it's an empowered person or institution that can give more. And the second priority is health for all. Today, as you know, 400 million people, 1 out of every 17 of the world's citizens, lack access to one or more of the essential health services. So when I say health for all, we need to break all the barriers. And I said it earlier, I don't want to repeat. What is important here is the political commitment. Otherwise, resource is not an issue, especially if we use universal health, if we put universal health coverage at the center. It addresses almost all issues. Even it's with stronger systems, universal health coverage, that we can fight emergencies more effectively. Then strengthening the capacity of national authorities and local communities to detect, prevent and manage health emergencies, including antimicrobial resistance, and promote global health security will be my third leadership priority. On this, the key issue is to implement the international health regulation in full without cherry picking. And the second is implementing the new emergency response that was ratified in May 2016 in full again, but we need to have the commitment to fully finance it. Yesterday I attended the finance dialogue and it was not funded, but we wanted to have the emergency response in WHO. So that has to be addressed, and we should ensure country ownership and also country capacity. And the global health security agenda will also be very important to address the challenges. And the key in global health security is to implement it, and to implement it. I think we don't need to go into another round of reform. We have a whole package, new design. The key thing is now implementation. And the fourth priority is putting women and children and adolescents at the center of global health development agenda, and positioning health on the gender equality agenda. In too many places, gender gaps, harmful cultural and social practices, and gender-based violence are negatively impacting the health, dignity, and rights of women and girls. Countries grow, develop, and have stronger communities when women and girls are healthy and empowered. But there is a serious weakness in doing honest assessment of the challenges and their needs. We don't listen to them, and we don't ensure ownership by them. I would reorient WHO to women, children, and adolescents by increasing the focus on reaching populations in humanitarian, fragile, and hard-to-reach settings. And also, I will advocate for increased investment. The details, I think you can read it in my statement. And the fifth is health effects of climate and environmental change. Climate and environment change is a global challenge that will continue to have a severe impact on our planet and on the health of our people. We have to take it seriously. It's a real problem. It's a real challenge. Of course, the world is coming together now. We can see the solidarity. But the health impact should be taken serious, should be given serious attention. And strengthening national capacity to effectively access and understand the use of climate service is important. Research and development on climate change is important. And also I will champion the use of low carbon approaches and also funding, especially to those who are most affected, like the small islands. In conclusion, I believe that a fresh vision of the World Health Organization through inclusive partnership can make all the difference. The world must learn from those who fight every day to safeguard public health, those who have struggled and triumphed against some of the most critical health challenges. I am deeply humbled to have received the endorsement of the African Union for my candidacy and the financial support for my campaign. I am also grateful for many countries throughout the world who have provided the support I have received. WHO's work touches hundreds of millions of lives around the world. Every program, every initiative, every allocation of funding is so much more than a static or line in a budget. It's a life protected. It's a child who gets to see adulthood. It's a parent who watches their child survive and thrive. It's a community living disease-free, or an entire country or region that's better prepared to handle emergencies or disasters. This is the difference WHO can make, working hand in hand with member states and global partners with candor. I hope you will join me in working together for a healthier world. I'm ready to serve. I have the passion, hands-on experience, technical expertise, political leadership, and diplomatic skills to lead WHO for the 21st century. I will continue to listen, and I will make sure that our relationship will be based on candor. Without it, we cannot build good relationship, and we cannot change and strengthen our WHO. Shukran jazilan, shishe, thanks so much, merci beaucoup, spasiba, and muchas gracias, asante sana, amesegnalo in our language. Thank you so much again. Thank you.
Thank you, Dr. Adhanom.